Shelby Brayland. I'm going to be doing the lidocaine push, bolus, and the infusion, or establishing an infusion line of lidocaine. Lidocaine's an antiarrhythmic. And so I've got my orders here. For the bolus, it's going to be 0.7 to 1.4 milligrams per kilogram for the push. My patient is a 49-year-old female, and the patient also weighs 280 pounds. So when I'm going to try to figure out this bolus dose, since they're a bigger person, I'm going to go with 1 milligram for my calculations, just because they're a bigger person, to be able to, you know, hopefully it'll be a better dose for them to get their rate under control. I'll go through my 5 rights 3 times, and that's the right dosage, the right drug, the right route, the right patient, the right amount, and the right time, and at the end of all my stuff, the right documentation. So I'll do that 3 times. I'll do it before I draw up the meds, I'll do it after I draw up the meds, and I'll do it once again right in the patient's room before I go ahead and administer that medications. And I've got everything ready here. The patient has a central line. They have normal saline running in their 1 line, and later I'll be putting the lidocaine one on. But for now, lidocaine, when I looked it up, it is compatible with normal saline, so I'm going to be able to give it right through their fluid line that's running, and that'll be like more cost effective for the patient because I won't have to flush, you know, waste any flushes, and it'll be safer from an infection control standpoint. I went ahead, and I don't have the right syringes, I don't have the right syringes and stuff, but what I did was, since I just improvised with what I have, so I'm going to draw up 6.4 mils of the lidocaine, and I had to do it in 2 different ones. And then I also, for the ease of giving it over the time frame, because I'm going to give it over 3 minutes, 3 milliliters per, or over 3 minutes. So I drew 2 milliliters of normal saline up because I've got 6.4 here, and I wanted to equal it out so I could give a mil a minute. When I come into the patient's room, I'm going to have washed my hands, introduce myself to the patient. I will check their wristband against the MAR, and I will also ask the patient to state their name and their date of birth from the 2 identifiers, so I make sure I've got the right patient. And then I've got everything ready. I've explained the procedure to the patient, and then I'm going to go ahead and I'm going to get my pad ready here. I'm going to scrub the hub for 15 seconds, not only on the sides but also on the top. Make sure you get the whole thing scrubbed clean. And I've already put everything in here. I'm just pretending, but I will have taken all my lidocaine medication and put it in here. I've hooked it up, and now I'm going to go ahead and I'm going to administer this over 3 minutes. If it's too rapid of an infusion, you can cause seizures. So I'm going to go ahead and I'm going to give 1 mil every 20 seconds. So I make sure it's a nice slow infusion. So I'll go ahead and do that. And I'm done. Then I'm going to go ahead and I'm going to get my lidocaine infusion ready to go. So it's already been primed. Right now it's clamped. But I'm going to go ahead and hook it right up to the fluids that are running, because remember, they're both compatible. So I'm going to hook it right up to the fluids there, instead of going and having to flush and put it on another line, because this is going to be more cost effective. I'm going to go ahead, unclamp it, and I'm going to get my pump started. I'm going to run it piggyback. So this one's already running, and I'm going to go ahead and run it piggyback. And when I did my calculations for this patient size and for the 2 milligrams per minute that needs to be done, I am going to give 30 milliliters per hour for this patient. And then I'm going to also want to do patient teaching, because I'm going to want to remind them that this lidocaine can make them really dizzy, so they're going to want to remain at bed rest. If they need to get up to use the washroom, they're going to need to call me for assistance. And it's just best to just stay in bed. The other thing is I want to let you know that this patient also had a morphine allergy, but I'm aware of that. The antidote for lidocaine is oxygen, epinephrine, which is also known as adrenaline. You can use antihistamines, like Benadryl if they break out in a rash. Vasopressors, I believe dopamine is a vasopressor. Corticosteroids, albuterol, IV fluids, and then always when you're giving a medication like lidocaine, have ventilation equipment handy.